studying, working. Studying, few people have been involved with studying. Volunteering definitely seems like something people could get involved with early on. Scribing, nice. Nothing, okay. Registering voters, me too. Dentist, helping registering voters. All right, this looks great. All right, thank you all for sharing. I don't know how many of you have come across our COVID page on the website or the resource that we've been sharing since late spring, helping to guide you to available resources in your community. But I'm going to turn the presentation over to Megan now, and she can introduce herself and take over and share that virtual resource with you.
Okay, hi everybody. For those of you that don't know me, I'm Megan, and I'm the graduate assistant at HPAL. So a lot of you have probably already seen this Google Doc that we have for virtual resources. Not sure if I can click on it. Is anybody able to click on it for me?
That's me, Megan. I'll go to it.
Thank you. I just want to bring your attention to one of the sections on that doc. It's the read, listen, and watch section. So once Annie scrolls down, I think it's like on the third page. Yes, right there. So in this section, we have book recommendations, we have blog posts, we have articles, documentaries, podcasts. So they follow various health professionals and provide insight into your chosen career path. It's a really great way just to learn and engage in a virtual setting and kind of get that clinical insight when you're not able to actually be in a clinical setting. So the topics on all of these different resources are everything from advice on admissions, insight into life as a medical student, stories from health professionals about impactful experiences they've had as providers. There's a lot of good content on here, and it's just a valuable way to, learn about the core competencies in action, better understand, the complexities of patient care, the social determinants of health. It's a really good way to engage in a virtual setting. So I recommend that all of you take a look at this.
Can you share with them, Megan, where on our website, or maybe Annie, you can take them straight to it real quick just so that they can see where that resides? This is a document that, as Megan said, is lots of helpful resources that's ever expanding. And it's a document that actually colleagues of ours from across the country have been adding to and working on since April. So this is a living, breathing document, and hopefully you found your way to it. But if you haven't, here it is. And if you're struggling for ways to get involved, this is one idea. And I think, do you have anything more you wanted to add on it, Megan?
I don't think so, but it's something that we're continuously adding to. Aside from the re-listen and watch section, there's, ideas to get involved both locally and virtually in terms of volunteer, clinical, and just ways to, prepare yourself for applying to med school or professional school, whatever school that you're applying to.
Great. Can we go to the next slide? And I think this one is Courtney, if I'm not mistaken. Is that right, Court?
It is me.
Hi everyone. It's so good to see you all. I feel like every time I see you all, I'm like, I wish we were in person, but I really do. But it's so good seeing you all just here. I want to chat a little bit about an informational interview and kind of the value that an informational interview could have in not only prepping you for the realities of the tumultuous happenings of a career in the health professions and kind of the sociological happenings that accompany it, but also so that you're thinking a little bit more longitudinally about the careers in the professions that you're applying to. So, Annie, if you want to click on the link in the bottom right, Wendy and I were just kind of shuffling through some ideas of questions that you could ask someone in an informational interview. And really like what the goal of that would be. So start to look at some of these questions, and maybe if you have other ones that you can think of, throw them in the chat just so that we can add it. But it's such a great opportunity for you to move from, hey, I'm shadowing this person, or I was doing this clinical volunteering at X hospital, to now have a conversation with someone who is in the field and say, okay, the realities of me shadowing or me coming into the office are not the same anymore, but let's have a real conversation about your career and why you chose it, what is challenging you, how you move through your daily thought process, what things you love about your job, what things you absolutely despise about your job. What are you looking for in terms of like your own personal development? What are you looking for in terms of professional development? Keep scrolling, Annie. Keep scrolling, keep scrolling, keep scrolling. Oh, we've invited people to this. Oh, okay, don't scroll that far. So we have this kind of sectioned out, and go up a little bit for COVID questions and telehealth. I think that this is really where you all will start to learn something truly brand new, is getting an idea of how professionals have had to pivot to telehealth and really how they've had to pivot their entire healthcare processes around them, whether it's from seeing patients, meeting with their families, not being able to meet with their families, now having access to a new patient population that perhaps you didn't have access to begin with. So there are things that were lost through this transition to telehealth, and there are things that have absolutely been gained. So I think that this would be a really great set of questions to ask someone, but also I can guarantee that these will be questions, something very similar to this will be secondary questions that you're going to see on your application. So if you're having these conversations with professionals early, you can get a really realistic idea of kind of the response around telehealth and COVID. Keep shuffling up, Annie. We're down. Nice, nice, nice. Perfect. We've been talking a lot about personal competencies, and it's something that as an office, we've been developing our own ideologies around personal competencies and what they mean and how you gain them. And so it's really about your value system, your core values, your morals, your why, what drives you, ethics, morality. And so I want all of you to be not only thinking about this on your own behalf in terms of how have my experiences embodied these competencies, but also be very direct with the folks that you're going to be interviewing with and ask them about those core competencies. You don't go home every day and say, how have I shown integrity today? And so actually having these conversations and being very clear and direct with what competencies you have the ability to develop is really important. And then I think we have one more section, maybe for some dental. Yeah, and then for our dental students, you all have very specific questions that you could be asking in an informational interview, especially around your clinical practice, because dentistry is such a hands-on, in-person profession. And so I would be super curious to know what you all are learning about not only how the practice of dentistry has changed since COVID and telehealth has been been a new wrench in our system, but also how dentistry has evolved over the years and how it will continue to evolve given these other variables that we now have to consider. Are there any other questions that you all can think of? Please just like throw it in the chat or unmute. Any other questions that you all think would be valuable in asking someone in an informational interview? Maybe, maybe not. Okay. I know that informational interviewing is a very new, oh, wait, I'm just a slow typer. Informational interviewing is a very new concept, and it's something that I want you to get comfortable doing. You can reach out to your current social network. So if you've shadowed someone in the past and you're like, hey, I had a pretty good relationship with that person, I wonder if they'd be open to a 45-minute, a 30-minute, 45, an hour conversation with me to kind of dig through some of these questions. Use those resources, but also think about the listserv, right? If some people are willing to bring you into the clinic, that's awesome. Some people are not there yet and are still wanting to do things virtually. And so reach out to folks that even who wouldn't come into your immediate social circles, reach out to them as well. Chaitali added something. Oh, Samaria. I think it's Samaria. I'm sorry if I'm mispronouncing. I think we could ask them about how their methods of caring for patients have changed. That is an excellent question, how their methods. And so we're adding this directly to the document. And then Chaitali says, going through a lot of personal professional development in order to become a clinician, but what growth or goals are you looking for or working towards once you become a practicing? Samara, thank you. Sam, these are great questions. So as you consider and think about those questions, even throughout the rest of this little presentation, just drop them in the box and then we will upload them directly to the informational interview and you all will have access to the informational interview document. Any questions about this before we chug along?
I just wanted to add, Courtney, thank you for that great presentation, that Nick and I had a great opportunity to talk with some of our alums who are far enough downstream now that they are actually practicing professionals in their field, which is where some of these questions were generated from. And in particular, I had a wonderful conversation with a dentist who is actually out of the area in Charleston, but doing telemedicine. She's on our alumni contact list, as are the other two folks that we talked to about, you know, kind of getting a handle on the medical questions. And so later in the presentation, he might even be next, I can't remember, Nick will talk about alumni contacts and how to use them and how to use the students who've gone before you to maybe engage in some of these great conversations. But I don't know if is Nick next? Nope, it's Kayla. All right, so Nick will be after that.
All right, cool. Thanks, Court. And Wendy. So hi everyone, I'm Kayla. I'm the Allied Health Academic Advisor. If you haven't seen me, come and see me. I am going to talk to you rather quickly about making relationships with professors, specifically virtually. I know if you are a sophomore, junior, or senior, right, like you're used to having your classes in person, going to office hours in person, going to see your professor after class at the front of the room. That's a little different now, obviously, because we're all virtual. But that doesn't mean that your relationship making abilities go away, especially you all, right? Like you all make connections through the internet, social media. You guys are good at that. So think of it just like that. Your professors want to make relationships with you, and they're also struggling through this time of not being in person with you all. So take the extra step and reach out to them. How do you do that? Well, I actually made a whole YouTube video on this. It's like 8 minutes long. It's really not, boil some water, macaroni and cheese pasta, and listen to this YouTube video. It's not long, but basically the gist of it is go the extra step. Discussion boards on ELMS are probably a big thing that you're doing right now for a lot of your assignments. And yes, you're probably just, writing your discussion and commenting on 2 of your classmates because that's the assignment, right? We're just getting it done. But your professors are going to read those. So if you're commenting extra or like actually putting some really in-depth thought into your responses, they're going to read that and they're going to notice that and they're going to see that you're going the extra step. So that's kind of one way to maybe get the attention of your professor without having to raise your hand all the time in class or something like that. Set up an appointment with them. Go to their virtual office hours. Ask them how their semester is going. Ask them for tips and tricks on studying Orgo or drawing, chemistry sequences or, the same thing that you would do in class, you still have the ability to do virtually. You just kind of have to go 1 or 2 steps more than you would in person. So watch that video. Let me know what you think. Let me know if you have had success with creating relationships with your professors, or if you're having trouble. I'd be more than happy to talk to any of you all about that. But yeah, that's that.
Hey everyone, and thank you, Kayla. Thank you for all of you all for participating today. Up to this point, you've kind of gotten a little information about interviews and kind of questions to ask. You've gotten information about letters. But one of the things that we definitely, as Wendy had mentioned, is we have a list of alumni resources that we've provided for you on that we constantly are trying to evolve, update, and expand and add to as we get more alumni each and every year. And 2 of the things that we have that in more of a recent internet or social media presence that we've had throughout the last few months is our LinkedIn page. This is where we encourage all of you all, obviously, to subscribe to it and subscribe to it, I guess is the best term. So that way, not only are you connected with some of our alumni, but also when the time comes and you are in professional school, you can hopefully give back to the pre-meds that are at Maryland at that point in time. So Annie's going to go ahead and pull up the LinkedIn page just so you kind of get a sense of what it looks like and some of the things that are on there. So this is our LinkedIn page. Obviously, I'm sure everybody is familiar with LinkedIn, but definitely become a member of our LinkedIn page. This is where we're always going to be posting information about our alumni, information about links that you can follow, whether it be a research, anything that's relevant for you, articles, whatever it may be. It's going to be information that's going to be pertinent to you all and expanding your knowledge in preparation for medical school as a pre-med student. So that's our LinkedIn page. And as you notice, we already have over 300, so we definitely want to try to get that to. The goal one day is hopefully to get it up to 1,000 or larger, but the more you all subscribe and the more alumni we get to subscribe, obviously we'll get closer to that 1,000 plus. So the other thing that we have that you all can take advantage of is our alumni contact list. Now, our alumni contact list are individuals who have already graduated from the university and are currently in professional school, and some of them are even graduates of professional school. And as you can see, we've got the list of allopathic, MD, PhD, osteopathic, dental, optometry, and so forth. We even have allied health included as well. And this is an opportunity for you all to reach out to these individuals to get more information about the profession, more information about the school that they attended. If you're when the time comes for you to apply to a professional school and you find that there's somebody who interviewed at Pritzker Medical School, and you say, you know what, this is somewhere where I have an interview at in a couple of weeks. Let me reach out to this person and get more information about the med school and what all it's like to live in the Chicago area and so forth. So this is a resource that we've devised for you. As you can see, it's a work in progress because we are continuing to update it and expand to it and make it a little more streamlined for all of you all. And then the other thing, which is really the star of our presentation, is we have a group of current students who have participated in virtual experiences, and they're going to talk about their individual experience, what they've done, how they acquired these experiences, and the amazing opportunity that these individual experiences have been for them. And so I'm going to go ahead and pass it on to them. But again, these are the stars of the show, and they have a very direct insight into things that you may be thinking about or considering as you go forward.
Okay. Hi, my name is Andrea Orpia, and I'm a junior neurophys major on the pre-med track. I'm also minoring in humanities, health, and medicine, and I'm from Ellicott City, Maryland. So all of these experiences, since I am a junior, I'm fortunate enough to have had before COVID, which has helped, but they've definitely changed a lot in their landscape, particularly for clinical volunteering. I've been volunteering at an underserved clinic that's nonprofit in Rockville, and it's called Mobile Med. And they have relied a lot more heavily on telehealth. And I think it just shows a lot about the changing landscape of healthcare, because now not only are social determinants of health, such as technology, being exacerbated, but you also see some patients have lower satisfaction because they don't see it in person. And also some physicians aren't able to do certain procedures over telehealth or over the technology. So it's definitely important to see that and to see how they've had to abruptly transition to a system, kind of find like a telehealth system to use, and also like teach the patients how to use it, especially because a lot of them don't have the technology that they need. So that's been a really cool experience for me to see. And I've also been volunteering in person, where it's pretty much half telehealth, half in-person clinics. So I think it's important to be able to still see this clinical volunteering. And I think if you are searching for an opportunity, a lot of the nonprofit clinics that rely on volunteers are severely understaffed. So if you want to look at those types of clinics, that's definitely important. And then as for research, I was lucky because a lot of my work was already primarily online before the pandemic hit, but obviously we're not able to go into the labs, which is difficult. But I think you just need to keep staying involved. So personally, I've been attending Zoom lab meetings. We've been doing journal clubs every week so that even if we can't meet in person, at least we're talking about material and kind of staying involved within the scientific community. And even if you're just getting started on research, I think a great way is to keep doing background readings or do data analysis if you can, and also organize consistent Zoom meetings with your PI. I've been doing sort of bi-weekly check-ins. Just because it's hard to get a hold of them. You can't just go into the lab anymore and have a chat with them about the progress you're making on your research. You're going to have to make an effort to stay on track with everything you're doing. And as for some clubs, we've definitely had a lot of problems with engagement and just kind of being able to carry out our mission. So personally, I've been involved in Healing Harmonies and Vintage Voices. And prior to COVID, our missions were to perform at hospitals or nursing homes and basically just help spread joy to patients and residents who need it. But obviously we can't do that now because a lot of healthcare facilities are prohibiting visitors. So what we've been doing instead is kind of thinking of creative ways to still be able to stay involved with those facilities. So for Vintage Voices in particular, we're starting a pen pal program. And then for Healing Harmonies, we're doing YouTube videos. Since we can't perform in person, at least we're still able to send it to hospitals and kind of carry out our mission. And it's a great way to still get service, even if you can't be there in person. So I think a lot of what the pandemic has taught me is just to be adaptable, be resilient, and kind of think about how you can still contribute to your community, even if you can't be there in person.
Andrea, before we move on from you, I wonder if you could just find maybe one example of something that you've been surprised to discover is maybe even better in this new normal than it was before. I mean, I was thinking maybe even about your Zoom lab meetings, if maybe they're more, everybody's able to be there or something like that, but maybe you could just come up with an example for us.
Yeah, I honestly think this is helping me create a better relationship with my PI because it's kind of a one-on-one 15 or 30 minute Zoom meeting where we can kind of just focus on me, especially because a lot of professors are super busy. They might not have time to focus on you, especially because they have grad students or other undergrads that they're working with. So I think in some ways it can help you create stronger relationships with PIs or professors if you do reach out to them and make an effort to, a PI is a principal investigator, so basically like the head of your lab. But yeah, I think it's helping me create a stronger relationship with him.
Yeah, I wondered if that might be the case. Thank you. Stick around because I'm sure we'll have some questions afterwards. And so we'll move to the next slide, Annie. And we'll hear from Lisa.
Hi everyone, my name is Lisa Honoro. I am a public health science major and I'm on the pre-med track as well. I'm from Baltimore County, Maryland. So this past summer, I participated in the Summer Health Professions Health Program at Rutgers, New Jersey, so SPEP. And I applied to this program in March March was the deadline, and we got the results, or we got accepted, I think probably in April. But by then, COVID had already hit and we didn't know what was going to happen. So we had to wait for a couple more months. Usually it would start in June, but it ended up starting in July, and it went from a 6-week program to a 4-week program that was online. So I found this opportunity by first setting up an advising meeting at HPAL, and I talked to Nick. We talked about like several different kinds of opportunities that there were. This was way before COVID. So I had previously applied my freshman year, but I didn't get in. But I applied again just to make sure, you always want to continue to use all the resources that you can. So then I went to their website and filled out the application. And like I said, I got accepted. And it went from in-person to online. So the way that they made this work was that we had classes. So we were divided into, I think, 2 groups. And we had 2 main courses that we were doing. So I was doing anatomy and physiology and biostatistics. We would have classes from 10 a.m. to about 12, and we would have one-on-ones with different doctors and different healthcare professionals. There were nurses, physicians, and pharmacists, and we were basically exposed to what they did on a daily basis. Although it was way different than I would have expected, it was still amazing. I was able to build a community with my cohort. Even though it was online, it's still possible, and I really urge everyone to try as much as possible to create that sense of community and create that relationship. So we did things like body interact modules, and these are basically simulations that you would do on virtual patients, trying to give yourself a view of what it's like to be in that kind of situation in a medical healthcare facility. So how did it help me evaluate what work in medicine and dentistry and nursing looked like? It basically, we were given, like I said, one-on-ones with several healthcare professionals. We were also able to have them present to us, we got to see many panelists, much like this, and they explained their backgrounds and histories. It was very motivating to see how everyone came from, basically like us. We're all college students. We don't know where we're going. We're kind of, sometimes, you get knocked down. You don't know how it's going to go. But basically, they really, really encouraged us to continue, because if medicine is for you, if dentistry is for you, nursing is for you, you're going to make it. And that's basically what I learned from that. They showed us how medicine can be a part of our lives in a healthy way, basically how to create that healthy balance between work and lifestyle. And they definitely explained the stressors. They told us that it's going to happen. You already know it's going to happen. Many of us have faced it right now as college students. We all know that life is hard, but you keep pushing through. We got lots of coping mechanisms and methods that we apply that I find very useful now, especially with COVID happening. It was very, very helpful. And lastly, how did it help me understand the lived experiences of the people who will need our care? it showed us the intersectionality between academics, medicine, and public health. And that's one of the things that I love about my major. It definitely shows you that people are definitely more impacted by the quality of care and not just the quantity of care. We see that especially now with the development of telehealth care, and it's really impacted me and my view on how I will be able to provide care as a physician in the future. And it also gave me a very realistic view of healthcare disparities. The fact that before COVID, many people didn't have access to certain types of care, like primary care, especially simple things like getting their medicine. It was so hard, and even like consultations, it was hard. But through telehealth care, we've been able to kind of bridge that gap, and that's kind of what I've learned at SHPEP. If you have any questions, just let me know.
Thank you so much. I love that you pulled out those big questions that we talked about in the Are You Ready workshop a couple weeks ago and addressed them. That was really helpful. And it sounds like you sort of answered the question I posed to Andrea, which is, did you see any ways in which maybe this was a silver development, that there were some things that maybe you saw that worked better? Did you want to say any more about that question of what worked better before we move on?
Well, with that question specifically, I would say that, like I said before, telehealth care has definitely helped with allowing other people who didn't have access to certain healthcare necessities before to get that. Also with volunteer opportunities, like virtual volunteer opportunities, such as, I don't know if anyone else knows about this, but basically, you are an anonymous tip. So basically, you help somebody who might be having some kind of anxiety issue at that time. It's kind of like, I don't know the exact company that's doing this, but you sign up and you provide that person. You kind of calm that person down by talking to them in that way. So that's another way.
Thank you. Let's move on to the next slide, Annie. And we'll hear from Matt.
Hi, I'm Matt. I'm a senior neurophys major. This is actually going to be my last semester, but I actually did kind of one of these virtual interview type meetings over the summer with an endocrinologist that I met through a friend of the family. But I had originally set up to just do a normal shadowing type experience sometime way before, I think it was like February or January, before we even knew what was really going on. But so I had set up this whole thing of I was actually gonna shadow him, and then he knew somebody else that I could also shadow for a short period of time. But obviously, as things progressed, it became more and more clear that probably wasn't going to happen. So as a result, I had a bunch of conversations with him just over the weeks, especially as it grew closer to summer. And he kind of was the one who kind of gave out this idea of what if we met on like a weekly basis just over Zoom. We ended up doing about an hour a week. And he said we can meet over Zoom and I can just kind of take you through some of the stuff that I do and some of the patients that I see on like a weekly, well, not weekly, but bi-weekly and monthly basis. So what we did is we set up weekly Zoom calls for about an hour a week. And he was a professor at a medical school. So he actually already kind of had slides for endocrinology already kind of at the ready. And he really enjoyed teaching. So he we went through some aspects of endocrinology. We looked at case studies of personal patients that he's had in the past, obviously not going into the personal details, but case studies as to how he treated different patients. And then also just going through the physiology of the endocrine system in general, which was something really interesting that I feel like I really wouldn't have gotten had this been a more in-person experience. Just because I feel like in the clinic, I would get more of that patient interaction, and I would get to see more of how he interacts with patients on a daily basis, but not so much the actual science behind what he does and kind of his thought process as he's going through some of the times when he's not in the clinic and he's at home and he's trying to figure out how he's going to treat a patient the next day. So that was a really interesting experience that I felt I wouldn't have gotten had this not been a virtual experience. But and going back to some of the questions that I asked, one of the big ones that I feel is always a really good introductory question if you don't know what to ask them first. The question I always ask first is what specific part of endocrinology, why did you want to do endocrinology, or why did you want to do whatever field of medicine that you decided to go into? And his response was basically that endocrinology was had these long-term relationships with patients that you wouldn't necessarily get in other aspects of medicine, because he dealt mostly with chronic diseases like diabetes and other endocrinologic diseases. But I had a bunch of my questions answered as to kind of what telemedicine looked like. Especially, it was interesting seeing how it evolved over time, because when we originally started, he had just started doing these telehealth appointments. So it was interesting to see kind of how he was coping with it as it kind of developed further and further. And by the end of it, he had a lot larger of a grasp on like what was going on from before. So it was interesting kind of seeing that development. And it was interesting to have meaningful discussions as to like how he feels things are going to change kind of in the future, especially in regards to some of his patients, and even some overarching themes like diabetes, like how is diabetes going to, like, how are we going to see an increase in diabetes possibly over the next few years because of like the major changes going on right now. But yeah, it was a really interesting experience. I would definitely encourage anybody to try and just find a contact like wherever and whenever you can, in terms of finding a physician to shadow. That's kind of going to be the best way, is to reach out. There's not really any applications for these kinds of experiences. It's always just finding a person, connecting with them in any way you can. So I would definitely encourage just going out and trying and asking whoever will listen. But yeah.
I love that, Matt. Thanks so much. It's funny, when Nick and I were talking with Corey Williams and Ian Porter, who are two of our former students who are, fairly far along in their practice right now. Well, not very, but they're fully functioning physicians at this point. And that is one of the things that they emphasized, is that there's an attribute of people who go into the health professions that they want to be mentors and they want to be teachers, and others have done that for them, and it's just sort of part of their long-term training that, see one, do one, teach one. And I think that so what you were saying at the beginning about how this was sort of just, very clear that it was something that he was passionate about. I think that your advice to tell people to give it a try is really good, because people like to be mentors, and they like to talk through, these experiences. Do you want to answer the question about, like, do you think that there's anything about it that was better? Or do you feel like you kind of already did answer that as you went along?
I think the biggest thing was the getting the scientific kind of background for it as I went along, because he kind of had the time, and we had that one-on-one kind of relationship in that 1 hour that we would get, that he would be able to describe to me more in detail the things that were going on, that I felt like I probably wouldn't have gotten had it not been virtual.
Yeah. Yeah. And I liked the part where you mentioned how at the beginning it was chaotic, and then it got more smooth. And I think you all are in a really interesting time and space where you're going to be able to be on sort of the front or the beginning of a very new normal. And I don't think we're going back to, I don't think telemedicine is going to go away now. I think so this is a really interesting time for you to see how it works. Thanks so much, Matt. Let's move on to the next slide, Annie. And we have Michaela. And go ahead, Michaela.
Hi, my name is Michaela, and I am a senior biology major and French studies minor, and I'm on the pre-med track, and I live in Hanover, Maryland. So over the summer, I volunteered at a small COVID-19 testing lab called Integrated Cellular and Molecular Diagnostics. And before the pandemic, of course, they were not a COVID-19 testing lab. So I volunteered there in the process of them changing their operations to COVID-19 tests. I volunteered there in May and June, and I found out about it through someone posting it on their Instagram story. So it was by chance, honestly. And I also think I saw it once in either the HPAL or the CMNS listserv. And I got in contact with the lab by emailing the chief operations officer, and her email is on this slide. And I sent her my resume and told her who I was. I went to UMD, I'm a pre-health student, and why I was interested in the lab. This wasn't actually an in-person experience, unlike everyone else's experience. And so I interacted side by side with other volunteers, as well as the lab staff and lab technicians and things like that, depending on what role I was taking for the day. So I had two different roles there. One, I was a kit maker, and for that, basically, I just took all of the supplies that go into a COVID-19 testing kit and put them into a baggie, and that includes like the swab, the vial, pipetting the solution into the vial, and putting expiration dates and name tags on things, and that was pretty easy. And my team that I volunteer with, we produce 6,000 test kits per week. And then those test kits were sent out into the community, and they were used by community members, obviously, and those same test kits would come back into the lab, and that's when my second role came into play, and that's the molecular sorting. And for that, I would just do data entry and like code the patient's names to the database that the lab had, so that it would be easy to run the assays. And also I would help the lab technicians here and there just to make their days easier. So I did work directly with specimens, which was very nerve-wracking at first, but the lab has very good practices, so I never tested positive for COVID or anything, which is amazing. And this lab is committed to patient care, so they work around the clock, like basically all day, to ensure that all 6,000 test kits are produced each week. So I remember volunteering here once at like 8 p.m. during the week, and I was the only person in the lab. So yes, they work around your schedule, they accommodate you just to ensure that the community is receiving the tests that are needed during this pandemic. And I'm actually really grateful that I found this experience, because my previous volunteering that I had lined up for the summer was canceled. And it also felt amazing to be able to use the skills that I've learned here at UMD, like just in labs and courses that have labs, to help my community in some way. And I think that's important, because as pre-health students, sometimes it seems second nature, the things that we learn in school, and it's hard to imagine applying them to the real world. But what we do is not normal, and it's not skills that normal people in the regular world have. So it's good to know that I am a frontliner and I'm capable of being a frontliner, and that's exactly what I did during the pandemic. And I think my biggest takeaway from this experience was being able to see that all the work that I am putting in to reach my goal of becoming a doctor is worth it and does make a difference, because as a pre-medical student, sometimes like the work, the volunteering, the shadowing, it can just become very heavy on you and very time-consuming and effort-consuming. And it's easy to lose sight of your goal during this long journey because it is so long. But it's nice knowing that through this lab, I was able to produce a kit, and one kit goes to one person. So each kit that I produce helps an entire person. And I think that's a very big impact on the community. So we were basically helping 6,000 people per week. And it was also nice to just be able to contribute in a small way to the solution of the pandemic by providing tests and making tests available to everyone while living through the actual pandemic. And so I encourage everyone to apply here, or actually, you don't even have to apply. I encourage everyone to email Shannon to just try to volunteer here. It was a great experience, and I would definitely do it again.
That sounds like a great opportunity, Michaela. Thank you so much for sharing that. And we will grab that contact information for Shannon and put it into the chat so that everybody can follow up with that. I was wondering, somebody in the chat, Haley, said, so important that you were able to test out for yourself your interest in medicine, and your comfort was, kind of running into the fire, which was probably a little bit how it felt. Like you were probably a little bit nervous to begin with, that you were walking into, something that was a little bit scary. You could have been exposed. You weren't, but you tested that out. And I think that that's a really important piece. And I think you wrote an AMCAS section for yourself, the way that you just described that. So I hope everybody was really listening, because you not only said, what did you do, but why did you do it? What did you learn from it? What was surprising about it that you maybe didn't expect? So that was great. Thank you so much. And I guess we'll go on to the last slide. I think it's the last. Yes, Warren. So Warren, are you ready?
Yeah. Hi, everyone. My name is Warren Dansu. I'm a freshman, so I'm very new to the whole pre-health experience. I'm also a biochemistry major. I'm pre-med. I'm from Germantown, Maryland. It's like 20 minutes from campus. So this past summer, I didn't do much, I would say. I did two things. I'm currently doing one of them. So the first thing that I did was I was a brain intern at Lenox Hill Hospital, or virtually. It was a virtual internship at Lenox Hill Hospital in the Upper East Side of Manhattan, New York. And I guess I'll just talk about that first, because that was super fun. I totally enjoyed it. But let me tell you what it was first. I get so ahead of myself. But so there was they had this documentary. It was called Lenox Hill Hospital. And my friend who goes to GW, we were watching it. Like, we would have Netflix parties. We would watch this in, like, it came out in, I think, June. And we were just watching it. Like, we finished the entire first season in, like, a day and a half. And she's an EMT, and she got really, like, interested in, like, finding out how she can get more into it. And I was like, if you find anything, like, let me know, because, we were both super excited about it. And so she told me about the hospital doing a virtual internship. Like, we both knew that they did in-person internships from anyone ranging from high school to medical school. But obviously with COVID, they had to, cut that off. And so I guess their student outreach center was looking for a way to, engage pre-health and medical students. And they started this program, Brain Turns. That's what you're usually called, but they decided to format it for online. And so the Brain Turns online program was spearheaded by 3 doctors, two of those doctors were in the show, and 3 of them decided to do this: Dr. David Langer, Dr. Randy D'Amico, and Dr. John Bukvar. And those 3 surgeons, they're neurosurgeons, and they formatted this entire program for anyone who was interested. Anyone who wanted to could join. And I mean, I registered and I went through the whole process. It's not really an application process, but it was just like if you're interested, sign up for it kind of thing. And so the schedule was essentially from, if you can go to the next slide, please. Yeah, so the schedule, this was like the sample of one of the entire, it was from July to August, beginning of July to end of August. So this is like essentially the schedule for that entire time period, Monday through Friday, 9 to 12. This is a sample of my notes from my August 3rd neuro-oncology lecture with Dr. Linger. But the patient had their diagnosis was myelopathy. And so as like I guess our group would, assess the patient with Dr. Linger, sit down, and it was funny because he always had a neurosurgery right after this. So he would talk about, the case from the previous day. And so and then we would watch a procedure that he did on the patient and what, how it ended up working. And so the procedure that we did on August 3rd was a posterior cervical laminectomy fusion from the vertebrae C2 to C5. Long story short, he put in some screws and then realigned the spine. And then he fused, it took about 6 weeks, and he put in, he morselized the bones that he had taken out. So that way when the patient's bones grew back, it would morselize and, form back into place. I know that sounds like super exciting.
If I break in here, I think we are a little bit over time, but I want to make sure
I'm sorry.
Oh, no, it was great. And we're getting lots of input that it was very interesting, and I hope a lot of people will go now and watch Lenox Hill because it was an amazing series, and what an opportunity to work with those guys. That must have been very cool. We probably have maybe if we'll take 5 minutes and see if anybody has any specific questions for us, but one thing I want to address to all of you that's coming to me privately and publicly in the chat are questions about this slide deck and whether or not it'll be available. And yes, we'll send the slides to students who registered. So you'll get the slides, you'll get the evaluation of the program, and you can give us some feedback on how it was for you. And then we will, of course, be posting the information that we talked about on our website. So you'll be able to, go and follow up with the Alumni Resources, follow up with the Informational Interview. A lot of you jumped in there while we were presenting, and we're looking at it, which was really cool. So why don't we just quickly move over and see if anybody has any questions. And I think the best way to do this is if you do, maybe just raise your hand. You know how to raise the hand in the reactions. Is that right? How do you raise your hand? In participants. Thank you all. In participants, if you want to ask a question, go ahead and raise your hand to anyone who was presenting today. All right, well then I think we'll just thank our student presenters so much. It was really great to hear your stories. It really filled out this workshop really well. It was, it's one of those things that's evolving just like your experiences are, and we'll continue to share information with you as we get it, and we hope to see you at our upcoming workshops. And thanks so much. Have a great evening. All right, take care everyone.